So as you said, it's a terrible learning experience, but what good do you think might come out of this whole pandemic?
Yeah, I don't know. I'm not, I try, just like you, Keith, and everybody that's listening, we try to stay positive. And so at this point, I think we're trying to get through it all. You know, I don't know if any good is really going to come of this. And if nothing else, as I said, my hope is simply that we can learn from it. And I think the price has been too high for a learning experience. However, uh, you know, we MGMA, as an example, we've been supportive of legislation to expand Medicare telehealth for several years, and legislation has just languished. But we've seen more changes to certain federal laws in the last month than we have in the last 5 years. And I think, while um, you do really have to think about the glass half full when you talk about these things. But my hope is that, you know, maybe some of the access issues that we face in this country um, already could be helped by the fact that there will be a little more experience with telehealth and other ways of treating patients and prioritizing care so we can get our sickest patients the care they need, and do a little more triaging using the technology that we now have available. I mean, those are some immediate things, and my hope certainly is that the federal government and the states will, um, building off your last question, learn to better coordinate, think about, the fact that we've never faced, or short of world wars, we faced hurricanes and regional issues that have drawn resources from the federal government, but never have we really faced in recent times a a crisis of this magnitude, which affects, it does affect each state a little differently, but we have COVID in every state. And so there really needs to be more coordination between the state and federal government, and then especially with the federal government, more preparation in terms of supplies and other needed protective gear and ventilators, so we don't just face a free for all, the next time this happens. And I think that most experts, which I am not, reasonably predict that there will be another situation. We just don't know when. We just have to prepare.
Okay. Alrighty. So is there anything else you wish to add or anything you think I might have overlooked?
No, I just wanted to say, I really appreciate, we talk to medical practices every day and appreciate the challenges that uh, your viewers face. And at MGMA, we're working tirelessly to advocate for physicians and practices and patients, and just to make sure that we get care to the people that need it. Certainly there are the front lines of this crisis, but there's quickly becoming a the potential for an access problem on the back end of this, when all the care that has not been delivered is then demanded from our healthcare system, and is probably not ready for that surge either. So it might be an initial surge from COVID, and then a secondary surge from all of the health repercussions of the actual pandemic. And so, with that, I just would say that I wish everybody, certainly the best of health, and to stay safe. And again, thank you for this opportunity to share some of what we're learning at MGMA.
Well, and thank you for being here, Anders. And just to you and yours and everybody at MGMA, just stay healthy. That's
Thank
that's
you.
that's the big thing now.
You too.
All right. Thank you so much.